I'm Dr. Bernstein, and we're going to be discussing third-degree AV block. This is also called complete heart block. No P waves are conducted to the ventricles. The AV node or the His-Purkinje system may be the culprit, but it is completely out of commission. This is a very dangerous and unstable condition. The ventricles will go into their backup safety mode. If the escape rhythm is junctional, that is, it originates around the junction between the atria and the ventricles, it may be narrow complex and at a rate of about 50 to 60. More commonly, and especially on tests, it will be a ventricular escape rhythm, which is always wide complex and is usually at around a rate of 30 to 40 beats per minute. The atria will continue to contract at their native pace of, say, 60 to 100 beats per minute, so you will see P waves, but the atria and the ventricles are completely independent of and dissociated from one another. This unstable condition will likely require atropine and temporary pacing until an implanted pacemaker can be placed. Two particular settings that can cause this are inferior wall MI and calcium channel blocker overdose. Another cause of reversible complete heart block, which is often seen on tests, is Lyme disease. Making this diagnosis could spare the patient a pacemaker, so try and figure out if they have Lyme disease. Treat with antibiotics and steroids instead.